Yeah, and I was able to speak to Chief Spence before the declaration of emergency in the community. Since then, my teams have reached out, and I've also reached out to Grand Chief Garrison Settee about the acute mental health challenges that we are seeing, that we've seen through COVID, but also exiting COVID. And then, frankly, we have yet to quantify and fully understand, but it expresses itself in its worst forms, obviously, with suicide and iteration. And that is magnified also by the events of the last month in terms of the discoveries in and around residential schools and the association of specific plots with young souls. Magnified by the opioid crisis, which we see a lot out west, but has plagued the entirety of the country. So Tataskweyak is going through a suicide crisis. We've mobilized a number, and we can get you the details of the mental health supports that we've mobilized since then, as well as prior to that. But the solutions come with the financial support of the government in Canada, some of the specialized mental health supports that we can bring to bear in the community in a culturally sensitive way. We heard loud and clear, and this is a success from that we've seen with specific proof points through COVID, the importance of on-the-land options, both for, obviously through physical distancing, but also to improve mental health, connection to language and culture. Those are all options that have been advanced by Tataskweyak, and we want to make sure that the supports we bring are not overbearing, but actually reflect the needs within the community. We don't have all the answers. We need to acknowledge that first and foremost, knowing that the solutions do come within the community, and then how the Government of Canada comes in to support them. This is not limited to that particular First Nation. This is a crisis across the country. COVID has made it worse. People condensed in a very isolated spaces for a long time to keep themselves alive, but that has repercussions. Kids being removed from schools, and that social interaction that is missing in the formative years of people's lives. So that, you know, at its worst expression, that takes form of problematic substance use. It takes the form of at its worst, iteration and suicide, and that's what we're witnessing in some communities. But we're also seeing that as a result of the news that has come out in the last month and a half. And that's triggering elders as well that have still some difficulty in some cases talking about the abuse that they've suffered, but also their youth reacting, and that's one of the forms of it. We recognize that in the circumstances this potentially will not be enough, so we're looking at a number of options. In any of these discussions, because we're talking about the healthcare system, we have to fold in provinces and territories, and that's why we need our provincial counterparts, our territorial counterparts to step up, whether it's new treatment centers, centers such as these, all elements that can surround people when they're at their most vulnerable. There's no easy solution, and it isn't around the corner. It is a longer term solution. They were shocking. I think he recognizes today that he should have known better. Perhaps I don't want to put Chief Ganesh on the spot, but those words are very wounding for people to hear. I think the sad reality is that is a view that is held in this country. Egerton Ryerson in his treatise on industrial schools, quote unquote, clearly said that Indigenous people had to be ripped away from their culture and identity, and religion was the ultimate tool to do so and to effect it. So there's a concerted plan that had nothing to do with educating. And you look at the history and you listen to the survivors, these places resemble labor camps. People get numbers, and we fought a war over that. So, and things like that happened in this country. So, it is, I just wonder where people have been the last month, and if they hadn't realized before. So, what? He's offered his apology, but I think, Wab Kinew expressed it best in his response. I think it's unfortunate to hear those things. That said, the minister has presented his apology, and I have a job as a Minister of Indigenous Services to serve Indigenous peoples, but a secondary, very important part of my job is to educate my own people. I recognize that the minister is Métis, and I think he should be given the opportunity to reflect on those words. But I do also recognize that views like those, even as regrettably expressed, are ones that are still held in this country, and we have to face those head on.